Julie telling us in the news at 3 o'clock that deaths continue to climb. Saturday, Sunday, today, 23, many of them elderly. One wonders, looking at the data from Manitoba and comparing it to other provinces on a per capita basis, are our seniors still getting hit hard here?
I don't know if they're being hit harder in Manitoba than other places. I've not done that comparison, but it sounds like you're being hit hard. In fact, in Ontario, it looks like the long-term care center situation is resembling what it was in spring of 2020, which is not good. We thought we'd have that under control by a combination of policies and vaccination, but things are looking bad there.
Here, there is still a policy allowing those that are unvaccinated, they still have to be tested, to work in personal care home situations. That obviously is coming back to bite. Again, we don't have all the data, but just speaking with people that I know in the personal care home business, both in healthcare and in the business itself, it's very difficult for them because they're trying to get employees to work. It's to the point in some care homes where they're relying really on families to help out. I'm wondering from your perch in Ottawa whether that's what you're seeing too.
Yeah, it's a problem that we've known about for many, many months now, and there's not much headway on solving that problem. There's vaccine hesitancy amongst this most unfortunate sector, the sector that's required to work with our most vulnerable population, and that sector that really should know more about the power and safety of vaccines. So what do we do about it? We could say require them to get vaccinated, but many of them would refuse, and now we have a shortfall of workers. There isn't an obvious solution here except to outlay more intensive education campaigns, and while that is happening, overlay even more stringent testing criteria, better masks, and so forth. It's a bad problem, and I don't know what the solution is, frankly.
And I'm wondering if we need to just remove those who are not fully vaccinated or unvaccinated from the conversation. And in some situations, like personal care homes, with dealing with Omicron, which we have seen to be a more virulent in terms of its spread, should we just be testing all staff on a regular basis as they go into work? Because we know that even those who are boosted are contracting the illness, and many of them, again, asymptomatic simply because they have that level of protection.
Yes, I would agree. I think testing should be done across the board. There was a time prior to Omicron where vaccination in and of itself was a very strong protection against transmission, even though there was a narrative contrary to that. With Omicron, the power of the vaccines to prevent infection and transmission has been diminished, not to zero, but significantly. As a result, for this particular vulnerable population, we have to layer on top every tool that we have. That includes vaccination and testing.
When we look at what the numbers have been doing and governments as they try to balance that, I guess, that tricky thing that many of us don't want to have to do, and that is balancing public health and the economy. It's easy when we speak with health officials to say, do lockdowns and this and this and that. And we speak to businesses that say, throw it all open. Governments are trying to walk that fine line. Is there a way that we can transition from pandemic to being endemic, and as the catchphrase has become, live with the virus?
Well, first we have to realize that these two concepts are not mutually exclusive. There isn't public health and the economy as different concepts. They're intertwined. You can't have a healthy economy unless the population is physically healthy, and you can't have a physically healthy population unless they have access to goods and services and jobs. So you got to solve both simultaneously. And the reason the way I thought we were going to do this, that we kind of failed, was to inject into the community the appropriate public health measures to allow the disease to be controlled while allowing the economy to function. We kind of dropped the ball there, but it's still possible. It's still possible to open things up, require vaccination, testing, mask wearing, ventilation, have really good disease surveillance to allow us to descend upon those cases that we do identify with overwhelming power and suppress the outbreaks when they occur. It's still possible. It takes more focus and more resources. I think that's the way we have to do this as we transition, as you put it, from a tightly controlled public health emergency to a more open society with a boiling pandemic in the periphery.
with the University of Ottawa epidemiologist Raywat Deonandan, Richard and Julie with you on 680 CJOB. The theory is exactly what you said, but the reality is a lot of parents that I certainly know, and I'm sure it's the same situation with you, Julie and Raywat, that they've thrown up their hands, kids back at school, back at home because they've caught COVID. And I'm just wondering, Raywat, some have asked me for advice on this from you specifically. Do we all self-isolate in rooms, or just, you know what, treat the house as one COVID area? We all get it because we're fed up doing what we need to do. This is almost 2 years into it now.
I think everyone's mileage is going to differ depending upon what your tolerance for risk is. So if there's someone vulnerable in your household, like an immunocompromised person or a child under 5 who can't be vaccinated, maybe you want to consider really wrapping that person up with more measures to prevent them from becoming infected. On the other hand, if everybody else in the household is at least doubly vaccinated, the probability of having a bad reaction to this disease is quite small. So I would treat the household as the infectious unit. And we have to remember to distinguish between individual risk and population risk. Because of the awesome power of vaccination, for most people, this is not a dire threat to their health. It's just that if enough people get sick at the same time, it's a dire threat to the healthcare system, right? So we shouldn't be panicking about this as individuals, unless, of course, you are one of these unvaccinated or vulnerable people. But for everybody else, I think we don't have to be afraid. It's protecting society that matters at this point.
What's on your radar in terms of what you're watching as you kind of look at this, not so much like we do on a Manitoba basis, but as you look across Canada and around the world? Because often that's how we see what's coming our way.
Well, I'm looking at things like how good is the booster shot? How good is it at raising this thing we call the VET, the vaccine effectiveness against transmission? With the Delta variant, we had as high as 88% of diminishment of transmission. With Omicron, it's come down significantly, but that third booster might bring it back up again. I'm looking at whether or not the rapid antigen tests are as sensitive now as they were during the Delta regime, because if they are, we can use that to high effectiveness and to keep things up and running quite well. I'm looking at, in other parts of the world, if the wave is coming down and how quickly it's coming down, and whether and how large the following death peak is. So in South Africa and the UK, we're seeing the deaths rise some weeks after the initial peak of cases. We're seeing that here now too, and that's a little scary. So yeah, we're looking at really when this current wave is going to be over in its entirety. And looking around the world, it's going to be sooner rather than later, but at what cost and what will it leave behind?
Two very important questions that we'll hopefully delve into and maybe get answers another day. Appreciate your time as always. Thanks for joining us.
Thank you.